In this video, we'll explain how to know if you should stop eating avocados. You'll discover 10 warning signs that indicate this popular superfood might not be as healthy for you as it seems. Ignoring these signals from your body can lead to serious problems, including chronic joint pain, heart issues, severe digestive disorders, and in some cases, even life-threatening allergic reactions. We've ranked these signs by their level of danger, so you can understand which symptoms require immediate attention. Make sure to watch until the end to find out which situations can turn avocados from a healthy treat into a hidden threat to your health. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Number 10. Stop eating avocados if you notice worsening dental health or the appearance of acne. The creamy taste of avocados makes them an irresistible addition to countless dishes. But if you start noticing that your teeth are becoming more sensitive and your face shows signs of inflammation in the form of acne, it's time to pause and reconsider. This beloved fruit may hide some unexpected downsides beneath its smooth skin. One possible reason for these symptoms is the acidity of certain avocado varieties. Despite its creamy texture, some types of avocados have an acidity level that can erode tooth enamel. A study conducted by the University of Pennsylvania found that a diet high in acidic foods increases the likelihood of enamel erosion by 32%. Sensitivity in your teeth may be an early warning sign of more severe dental problems. When it comes to acne, the story gets even more interesting. The high oleic acid content in avocados can stimulate excess oil production in people with oily skin. Clogged pores create an ideal environment for bacteria, leading to inflammation. According to the American Academy of Dermatology, up to 15% of patients with acne report worsened skin conditions after consuming foods high in fats. An example from the practice of Dr. Lisa Raymond, a dentist in San Francisco, illustrates this issue. A 25-year-old student named Jessica sought help for her increasing tooth sensitivity. She was surprised to learn that her daily avocado toast ritual was the likely culprit. After making changes to her diet, her dental health significantly improved. To avoid such problems, consume avocados in moderation. Rinse your mouth with plain water after eating them to neutralize their acidity. If you notice skin issues, try temporarily cutting avocados from your diet and replacing them with lighter fat sources, such as walnuts or flax seeds. And of course, consult a dentist or dermatologist if needed to ensure your health is on the right track. By the way, American scientists have proven that grateful people who hit the like button live 7 to 10 years longer on average than those who are indifferent or haters. So, hit that like button and let's keep going. Number 9. Stop eating avocados if you feel weakness, fatigue, or memory problems. Avocados are champions when it comes to healthy fats, but they're not a perfect match for everyone. If you feel drained, notice difficulty concentrating, or experience memory issues after eating avocados, it could be a sign that your body isn't as thrilled about this popular fruit as you are. One possible reason is hypoglycemia, a condition where your blood sugar level drops below normal. Avocados are low in carbohydrates, but rich in fats, which require significant effort from your body to process. Research from the University of Illinois found that 12% of individuals transitioning to high-fat diets experienced cognitive impairment and overall weakness. Additionally, the high potassium content in avocados can disrupt the body's electrolyte balance. A medium-sized avocado contains about 975 milligrams of potassium, which is nearly 20% of the daily recommended intake. For people with sensitive metabolisms or kidney issues, this can lead to hyperkalemia, a condition that affects the nervous system and muscles, including brain function. A case from the practice of Dr. Mark Thompson, a neurologist in Miami, highlights this issue. His 48-year-old patient, Dan, complained of persistent fatigue and memory problems. A review of Dan's diet revealed that he was eating avocados daily, believing they were beneficial for brain health. Eliminating avocados from his meals helped Dan regain his energy and mental clarity. If you experience similar symptoms, consider replacing avocados with foods that combine fats and carbohydrates, such as oatmeal, with nuts. Drink plenty of water to support your metabolism and lower potassium levels. If your condition doesn't improve, consult a healthcare professional. Your health deserves careful attention and care. Number 8. Stop eating avocados if you regularly experience digestive issues and loss of appetite. Despite its creamy texture and exquisite flavor, avocado can sometimes cause unpleasant stomach discomfort. If you feel heaviness, nausea, or notice a sudden loss of appetite after eating it, this is not just a coincidence. These symptoms might be your body's way of signaling that it's struggling to process this particular food. Avocados are high in fats, about 15 grams per 100 grams of fruit, which makes up approximately 23% of the daily recommended intake. For people with sensitive digestive systems or conditions like gastritis or irritable bowel syndrome, this level of fat can be overwhelming. A study conducted by Oregon State University found that 18% of patients with digestive issues experienced worsening symptoms such as bloating, gas, and appetite suppression after consuming fatty foods, including avocados. One case described by gastroenterologist Dr. Jason Miller from Denver involved a 36-year-old patient, Trevor. He reported losing interest in food due to persistent heaviness after lunch. After a consultation, it turned out that his regular breakfast of avocado toast was the main culprit. Removing avocado from his diet helped restore his appetite and alleviate his discomfort. To address this issue, try eliminating avocados from your diet for at least 2 weeks. If your symptoms improve, consider replacing avocados with lower-fat alternatives like cucumbers or zucchini. Additionally, pair avocados with light, fiber-rich foods such as leafy greens to support digestion. To maintain your appetite, include low-fat dishes with bold flavors in your meals to help your body adapt. Number 7. Stop eating avocados if you experience increased joint pain or swelling in your extremities. If you notice aching joints or slight swelling in your fingers and toes after enjoying avocados, it might not just be a coincidence. These symptoms can sometimes be linked to the high purine and potassium content in this fruit, which is particularly concerning for people predisposed to gout or with kidney issues. Avocados contain purines, compounds that, when metabolized, turn into uric acid in the body. For most people, this isn't a problem, but if your uric acid levels are already elevated, avocados can make things worse. According to the American College of Rheumatology, gout affects about 4% of adults, and even a small increase in uric acid levels by 1 milligram per deciliter can raise the risk of a gout flare by 25%. Potassium, which is abundant in avocados, around 975 milligrams in a medium-sized fruit, can also contribute to the issue. Excess potassium can strain the kidneys, leading to swelling and general fatigue. Dr. Sarah Lawson from Chicago described a case involving a 50-year-old patient with chronic gout. After regularly eating avocados, his joint pain worsened to the point where he could no longer walk. Removing avocados from his diet helped lower his uric acid levels and reduce inflammation. If you experience these symptoms, start by reducing your intake of foods high in purines and potassium. Drink more water to help flush out uric acid and support kidney health. Consider adding cherries to your diet, as they have been proven effective in lowering uric acid levels. If symptoms persist, consult a doctor to determine the underlying cause and receive appropriate recommendations. Number 6. Stop eating avocados if you feel heaviness in your stomach or pain in your right upper abdomen after eating. Avocado is often considered the king of healthy foods, but even kings can cause discomfort. If you notice a feeling of heaviness in your stomach or a sharp pain in your right upper abdomen after eating this fruit, it could be a warning sign. Your body might be struggling to handle the high fat content. Avocados, despite their health benefits, consist of up to 77% fat by total caloric content. For individuals with gallbladder or liver issues such as gallstones or fatty liver disease, this can pose a significant burden. Research from the American Gastroenterological Association found that 15% of patients with liver disorders experienced pain and spasms, especially in the right upper abdomen, after consuming fatty foods. This occurs because these foods require the production of bile to aid digestion. If the gallbladder isn't functioning properly, it can result in painful symptoms. One case from medical practice involves 42-year-old Monica from Seattle. She consulted a doctor complaining of persistent heaviness after meals and pain in her right side. Her diet included daily salads with avocado. An ultrasound revealed small gallstones, and her high-fat diet aggravated their movement, causing spasms. Removing avocados from her meals and switching to a lighter diet helped her alleviate the discomfort. To avoid such issues, pair avocados with foods that aid digestion, such as fiber-rich vegetables. Avoid eating avocados on an empty stomach to reduce the strain on your gallbladder. If the pain persists, consult a gastroenterologist for a detailed evaluation. Your health deserves proper attention. Number 5. Stop eating avocados if you've been experiencing frequent headaches, nausea, and dizziness. Headaches can be the ultimate enemy of a productive day, but when they're accompanied by nausea and dizziness, it's more than just a random discomfort. Avocados might be the hidden cause of these symptoms, with tyramine and high-fat content being the likely culprits. Tyramine is an organic compound found in avocados, particularly in overripe ones. It has the potential to dilate blood vessels, which can trigger migraines. According to a study from the University of Minnesota, up to 20% of people who suffer from migraines report worsened symptoms after consuming foods high in tyramine. Additionally, a diet rich in fats can overwhelm the metabolism, leading to mild intoxication-like effects, especially in individuals with low physical activity levels. A case from medical practice involves 38-year-old Jeff from Austin, who suffered from regular headaches after breakfast. His go-to meal, avocado toast, turned out to be less beneficial for him than he thought. After eliminating avocados from his diet and consulting with a nutritionist, his migraines disappeared. If you notice similar symptoms, try replacing avocados with lower-fat alternatives like zucchini or carrots. Stay hydrated by drinking plenty of water to maintain fluid balance and ease your body's workload. If the headaches persist, consult a neurologist to rule out other potential causes. Your health is far more important than any culinary habit. Number 4. Stop eating avocados if you experience stomach pain, diarrhea, severe bloating, or gas. If your stomach suddenly starts acting up after eating an avocado, it's not just a coincidence. This superfood can be a real challenge for a sensitive digestive system. Frequent diarrhea, unpleasant bloating, or painful gas might point to avocado as the culprit. The issue could be linked to the significant amount of fructose in avocados, which many people struggle to digest. According to a study by Michigan State University, about 30% of adults in the US have difficulty processing fructose. In such cases, undigested fructose becomes food for gut bacteria, resulting in gas and diarrhea. Another potential problem is the high fat content of avocados, which can overload the digestive enzymes. For example, people with insufficient lipase, the enzyme that breaks down fats, may experience painful cramps and bloating after eating fatty foods like avocados. A case from the practice of gastroenterologist Dr. Steve Reynolds in San Diego involved 28-year-old Emily, who frequently complained of bloating and stomach pain. After removing avocados from her daily meals, her symptoms disappeared, and further testing revealed that she had fructose malabsorption. If you experience these symptoms, start by cutting avocados out of your diet for a few weeks. Incorporate more fiber-rich foods like zucchini or broccoli into your meals to help regulate digestion. Fermented foods such as sauerkraut can also support gut health by nourishing your microbiome. If the problem persists, consult a gastroenterologist for further evaluation. Number 3. Stop eating avocados if you experience rapid heartbeat or chest pain. You've probably heard that avocados are great for your heart, but for some people, this fruit can have the opposite effect. If you notice your heart beating faster or feel a heaviness in your chest after eating avocados, it's time to pay attention. One possible reason is the high potassium content in avocados. A medium-sized avocado contains around 975 milligrams of potassium, which is nearly 20% of the daily recommended intake. For individuals with an electrolyte imbalance, excess potassium can lead to arrhythmias and overstrain the heart muscle. The American College of Cardiology reports that hyperkalemia, elevated potassium levels in the blood, accounts for approximately 15% of heart rhythm disturbances in patients over the age of 40. Additionally, the fats in avocados require more effort for the body to digest, increasing the workload on the heart, especially for those with pre-existing cardiovascular conditions like coronary artery disease. A case from the practice of cardiologist Dr. Michael Hendricks in Chicago involved a 56-year-old patient, Mark, who complained of frequent heart palpitations after lunch. His diet included several slices of avocado daily. Tests revealed elevated potassium levels, and removing avocados from his meals helped stabilize his condition and reduce the risk of complications. To minimize risks, limit your avocado intake to once or twice a week and pair it with magnesium-rich foods like almonds or spinach, which help regulate potassium levels. Drink plenty of water to support kidney function and prevent mineral imbalances. If you experience similar symptoms, consult a cardiologist to evaluate your heart health. Number 2, stop eating avocados if you experience a combination of symptoms: skin reactions, joint pain, fatigue, and bloating. When your body sends multiple warning signs like skin redness, joint aches, constant fatigue, and uncomfortable bloating, it's more than just a coincidence. If you notice these symptoms after eating avocados, it could indicate systemic intolerance or an allergic reaction affecting several parts of your body. Avocados contain numerous bioactive compounds, including salicylates, substances that can trigger allergy-like reactions in some people. According to research from the University of Colorado, up to 2% of the U.S. population has heightened sensitivity to salicylates, which can manifest as skin rashes, joint inflammation, and digestive issues. Joint pain may also be linked to uric acid buildup, especially in individuals with gout or arthritis. Despite its healthy fats, avocado can exacerbate inflammation in people with chronic joint conditions. Fatigue and bloating, on the other hand, often result from an overloaded digestive system struggling to process the high-fat content and complex compounds in avocados. A case described by Dr. Andrew Carter in Boston involved a 40-year-old patient, Tom, who regularly consumed avocados in his smoothies. He began to experience persistent bloating, joint pain, and eczema on his hands. Eliminating avocados from his diet resolved all his symptoms within a month. If you're facing similar issues, start by completely avoiding avocados for a few weeks to allow your body to recover. To ease joint pain, incorporate omega-3 rich foods like fish or flaxseed oil into your diet. For skin reactions, soothing creams containing aloe vera or calendula can help. To support digestion, try herbal teas made from mint or fennel. Listening to your body is key to maintaining your overall well-being. And here's the most important point on our list. Number 1, stop eating avocados if you experience severe shortness of breath, throat swelling, or skin rashes after consumption. If eating even a small piece of avocado makes it hard to breathe or causes your throat to swell, it could be more than just a mild allergy. It might be a life-threatening condition known as anaphylaxis. In such cases, delaying treatment could be fatal. Avocados, like some other fruits, are linked to a condition known as latex fruit syndrome. According to research by the American College of Allergy, Asthma, and Immunology, up to 50% of people with latex allergies experience similar reactions to avocados. Symptoms can include difficulty breathing, skin rashes, itching, and redness. Throat swelling occurs due to a histamine release triggered by your body's response to the allergen. This leads to narrowing airways, making each breath increasingly difficult. Without prompt medical intervention, this condition can result in suffocation. An example from the practice of allergist Dr. Sarah Mitchell in New York highlights a case involving 35-year-old Mary. After eating an avocado salad at a corporate dinner, she felt an itchy throat and severe shortness of breath within minutes. She was rushed to the hospital, where an epinephrine injection saved her life. If you suspect you may be allergic to avocados, eliminate them from your diet immediately. Always carry antihistamines, and if you've experienced a severe reaction, discuss the possibility of using an epinephrine auto-injector with your doctor. Avoid not only avocados, but also other fruits associated with latex fruit syndrome, such as bananas and kiwis. Your health is in your hands, and timely caution can save your life. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.